Heart transplant is a surgical procedure where a diseased or failing heart is replaced with a healthy heart from a donor. This transformative medical procedure stands as a beacon of hope for those with end stage heart conditions. So join us as we reflect on the importance of heart transplants, aiming to inspire understanding and appreciation for this extraordinary life saving intervention. Welcome, everyone. I'm Dr. Soumya Saluja from THIP Media, and to help us explore the significance of a transformative medical procedure such as heart transplants, we are honored to have with us the renowned health expert, Dr. Dhiren Shah. Dr. Dhiren Shah is a distinguished cardiothoracic and vascular surgeon serving as the director and consultant cardiac surgeon at Marengo CIMS Hospital in Ahmedabad, Gujarat. With over 16,000 coronary artery bypass graft surgeries and 55 heart transplants and 7 lung transplants to his credit, Sir started the Heart and Lung Transplant Program in Gujarat, Marengo CIMS Hospital. He is pioneer in minimally invasive cardiac surgery in India. Sir also started a robotic cardiac surgery program in Gujarat. Dr. Shah earned his MCH in cardiothoracic and vascular surgery from Delhi University in the year 2002, graduating with a gold medal. He has introduced innovative procedures in India, including the first transaortic transcatheter aortic valve replacement and hybrid coronary artery bypass grafting. Sir's areas of expertise encompass heart transplants, heart failure management, valve surgeries, complex bypass surgeries, and congenital heart disease. Dr. Shah is an active member of the Indian Council of Medical Research Committee and the Government of Gujarat's Working Committee for Transplantation Programs. Beyond his surgical practice, Sir is dedicated to patient education and has developed mobile applications to guide patients through preoperative and postoperative care. Sir's commitment to advancing cardiac care has established him as a leading figure in the field, both nationally and internationally. Dr. Dhiren Shah, THIP Media welcomes you, sir.
Thank you. Thank you for inviting me here.
Thank you so much for joining us today. So we all understand, that end-stage heart conditions, they can be a little life-threatening and, of course, emotionally overwhelming for patients, right? So yet, many individuals, they may feel apprehensive about undergoing a heart transplant. So to bridge this gap and foster clarity, I'd like to begin this discussion with the most fundamental question that what medical conditions typically necessitate a heart transplant procedure?
I think so. Very important and basic question, and I think so. There is a lot of myth and a lot of misconception in the society and even in the medical fraternity also when to refer a patient for a heart transplantation.
Okay.
So if you look at the whole spectrum of heart failure, the majority of the patient, the majority of the chunk of patient that needs heart transplantation or that are getting heart transplantation is idiopathic dilated cardiomyopathy.
Okay.
So idiopathic dilated cardiomyopathy means the heart muscle itself is weak without any reason.
Okay.
So that can be right from the birth. Over a period of time, gradually they have been becoming weaker and weaker.
Okay.
Second very important reason is ischemic dilated cardiomyopathy, that is after the heart attack. Okay. So you had blocks in your heart, you had a heart attack, and because of repeated heart attacks, the heart has become weak. Third is the valvular disease. So heart has valves also inside. So a lot of patients, they have valve issues and somehow they don't get it treated. So over a period of time, the heart reserves are gone, heart becomes hugely dilated, and then they are the patients of dilated cardiomyopathy. Fourth most common reason is the viral myocarditis. So patient who had a viral infection of any sort, so in between H1N1, then there was this COVID infection and all. So all these viral infections can damage heart very badly, and then they are a candidate for heart transplantation. And the last but not the least is postpartum dilated cardiomyopathy. That is, patient after the females after their delivery, there is some chemical reaction inside their body with the cells of the baby, and that causes the damage to the heart significantly. And this females, they get postpartum dilated cardiomyopathy. So these are the category of patients which requires heart transplantation. Very important thing is when is very important. This is basically the condition in which the transplantations are required. But when is also very important to understand. So I think so important thing is the timing when the patient should be referred for the heart transplantation, because in majority of the cases in my practice, when the patient is crashing or is almost on the deathbed with lot of support system around, and then the doctors and the relatives, they expect that heart transplantation should be done in an emergency. Let me tell you, heart transplantation is purely dependent on organ donation, and organ donation doesn't happen every day. So it is not that off the shelf I take the heart and replace the heart. It is not going to happen that way. Sometimes it may take almost 1 to 3 months to get an organ, which is very perfect for you. So important thing is, I always tell to the doctors and the patients that there is a golden period. You have developed heart failure. Once you develop heart failure, ultimately your other organs are going to get affected. So your kidney, liver, and all lungs are going to get affected. So before that organs get affected and the heart failure has set in, there is a golden period of, I would say, 6 to 12 months period. If you offer that transplantation to the patient in that period, then they have buffer time wherein they can wait for a good organ, get an organ, and get a good life. So before the other organs they deteriorate and the heart has started failing, golden period is there. Utilize that golden period. That is more important.
Like you just mentioned that heart transplantation is particularly required, let's say, for congenital, pathological, and of course for new mothers at times. You've just mentioned that when is a very important factor for the heart transplant recipients. So in line with that, what criteria are used to determine the suitability of a heart donor? And how is donor-recipient compatibility assessed?
So first, compatibility of the donor and the recipient is based on practically 2 or 3 things only. So first and foremost thing is we look at the blood grouping. Second, we look at the weight matching. So 20% weight plus or minus is okay. So 80-year-old man cannot get a heart from 50-year-old donor. It is, so it's just simple thing. BMW engine cannot work in the Maruti, or Maruti engine will not work the same way it is working in BMW. So that is the difference. Third thing that we always look into is the geographical distance, because you have a very limited period of time when you remove the heart from the donor and you implant it. So you get just 4 hours or 5 hours time. So the nearer the transplant center, better it is. Longer the distance between the transplant center and the recipient and the donor center, the outcomes may not be the best. So these are the 3-4 criterias. Obviously, HLA matching, majority of the times you don't get that time to do a matching, because the patient is 500 kilometers away from the donor to get the samples and then do the cross match. Practically, you don't get time. So when I get a call for a heart transplantation and I finish off the procedure, it is just 8 to 10 hours time. That's all. So practically, these are the basic 3 criteria on which we do the matching, or the matching of the donor and the recipient.
Right. And so how does this allocation system, prioritizes patients on the heart transplant waiting list? what factors influence, the waiting times?
So there are, UNOS has a very UNOS system, which is a US-based system, has matured over a period of time. In India, unfortunately, we still don't have very standardized system of allocating the organs. Different states in India have different policy. Unfortunately, it's very high time that Indian government takes up this initiative and create a national allocation system. But majority of the time, I would say the supra-urgent category of the patients are patients who are on total support system. So whether they may be IABP support system or they may be on ECMO, they may be on Centrimeg, that is temporary LVAD support system. So if these are the patients who are there, then they get a very high priority. The rest of the patients, obviously, they come into status 2A. So one is status 1 and then status 2.
2. Okay.
Yeah.
And like you just mentioned that practically we do not get much time even for the HLA matching between the donor and the recipient. So what is the ideal critical time window for performing a heart transplant once a donor heart becomes available to the recipient?
Ideal time is, that is what I'm telling you. Okay, I get a call probably say 6 o'clock in the evening. So what happens is, typically I'm talking about a typical situation. Morning, the patient is identified as a brain dead. Then counseling starts. So by evening, the apnea test, everything is performed. So by 6 o'clock, 8 o'clock, we get a call. There is a patient who is willing to donate. The family is willing to donate the organs. And next day morning, they want the body. So you get just a whole night. So majority, I would say, majority of the time, in 90% of the cases, my organ procurement is always in the middle of the night. So middle of the night, you go there and then you procure the organ. In the meantime, you call the recipient to the hospital, you get his investigations done. So everything is practically completed in 8 to 10 hours. So there is no ideal time, but what is important is what I was trying to mention in the first question was, which is the patient who now, with the heart failure, there are stages of heart failure, stages A, B, C, and D. So in probably stage A and B, you don't think of heart failure or transplantation at all. But when the patient enters into stage C and stage D, that is where you start talking to the relatives that probably he may require a heart transplantation, and they get mentally prepared. So if the patient is of heart failure, rejection fraction of 15%, patient is on optimal medical therapy for more than 3 months. In spite of giving the best medications, the patient is not improving. Repeat hospitalization is there. And very important objective test is the cardiopulmonary exercise testing. That is, we call it as VO2 max. So VO2 max is the test, or simple test is in 6 minutes, how much the distance that patient can cover. If the distance is less than 300 meters, that is the time that you should now enroll the patient for transplantation.
And now for someone who's just, received a donor heart, so the lucky ones. So what precautions must a heart transplant recipient adhere to during the recovery period to ensure optimal outcomes?
Yeah. So after heart transplantation, the most important and crucial period is the first year. So first year, if you take good care of everything, then your overall outcomes really are fantastic. Long-term outcomes are good. So first year is the time frame when you are on maximum number of immunosuppressive drugs. So it is a transplantation. You have to give immunosuppressive drugs. So first year you have the maximum immunosuppressive drugs. So infection is highest in first year, and rejection is highest in first year. So practically you cross first year mark, then the body gets adapted, your immunosuppressive drugs, they come down. So then practically the things are not much of issue. So what my protocol at our center is, for first 3 months, patient remains in one room only, wherein one or two person can enter and come out. He is not allowed to go out, except that the hospital visits which are required every weekly time. After 3 months, he is allowed to move around in the house. And after 6 months, he can move out of the house with the mask and due precautions. So practically, this is the routine protocol. So prevention of infection in any form, good overall hygiene care of the house and himself. Regular medications are very, very important. He cannot skip a single medication. And fourth is very important is the, I would say, the follow-ups and the regular investigations that needs to be done. In all my heart transplant patients, I always tell them that heart transplant is not just surgery. It is a disciplined life. And if you adhere to that disciplined life, then and then the outcomes are really good. So you have to follow what we say. At 1 month biopsy is required. At 3 months biopsies has to be done. This blood test has to be done at this time. Yeah, it has to be done. If you follow that thing, practically you get a fantastic quality of life for another decade or 2 decades or 3 decades also.
Wonderful. Okay. And like you just said, that apart from just precautions, saving yourself from infections, the rejection part is also very important within the first year after the surgery. So what are the common signs, indicating that a recipient's body is rejecting the newly implanted heart?
Very important. And this is what I explain to each and every patient when they are getting discharged. Any small deviation of your routine things, if you are feeling something abnormal, even it may be some palpitation, or you were able to walk 100 steps and then suddenly you are unable to walk even 50 steps, or you are having nausea, vomiting, or you are having some heaviness in your chest. These are very subtle symptoms or signs. But this may be a sign of a rejection. So I always tell all my patients that even if you have a small episode of any such thing, you just immediately call me up and I will decide whether that is a sign of a rejection or not. And obviously to confirm the rejection, the best modality is always the echocardiography. So we do ECG and echocardiography that will confirm there is a rejection because the heart function goes down. And then the real confirmation comes with the biopsy report.
Okay, right, sir. And you've mentioned that during the first year of recovery, patients, usually are confined to a single unit, and they're not supposed to meet more people. So again, I feel that when one has undergone a surgery, particularly a life-transforming one, such as a heart surgery or a heart transplant surgery, you need support. Right. So, in what ways can a recipient's family support them throughout this journey, let's say from pre-surgery to the post-operative care?
So, again, in Indian perspective, this is one of the most important questions. See, if you look at the selection criteria or indications in the Western country, US, psychosocial parameters are given a prime importance for that patient being eligible for heart transplantation. Unfortunately, initially in our Indian subcontinent, we never give that much importance to psychosocial assessment of that particular patient. So yes, very important. What we normally do is we do a very detailed psychoanalysis of the patient first. We make them understand that this is the thing that you have to go. Our psychiatrist and our psychoanalysis, they take good analysis of this patient and make them aware. And they again give me a report that this patient is not a good candidate for transplant, don't do, and this patient is a good candidate. Apart from that, what we always do is, before the transplantation, we have a family counseling almost 3 times before the transplant to even make them sensitize or sensitize them You see, this is the whole process that you have to go. Patient will have to go through that, and you will have to support him completely, him or her, completely from all aspects. So I think so this point is very important. Psychological analysis of the patient and psychological counseling of the relatives is very important. And what we have done is we have an online counselors also, whom they can connect with the patient on Zoom call. They do online counseling also, so that helps them to mitigate all this psychological depressions. And a lot of patients, they go into depression because they have to live in isolation for 3 months. So this is how we try to manage the psychological issues.
Right. And now I'm going to ask something from your personal experience. You just mentioned in the beginning of the session, sir, that you have been through, a lot of misconceptions even within the fraternity, apart from just the patients. So, what are some common misconceptions that, let's say, donor families may have regarding the heart donation process? And how would you address them as a medical expert?
So, from the donation part, organ donation part, I think so. Organ donation, there are a lot of myths there in the society. So, first and foremost thing, religious misconceptions. If from religious point of view, you cannot donate the organ. In fact, if you go through the scriptures, all religions, they promote organ donation. And in Hinduism, obviously, there is a lot of literature there and stories there, which have Vajra and all this. We have the stories. So first is this religious aspect. Second thing is there is misconception that if I donate my heart, my next birth will be without heart. If I donate my kidneys, I will be without kidney in the next birth. So that we need to make them understand. Third misconception is when you are removing the organs, you are going to mutilate the whole body. So that is what the relatives don't want. So we may make them understand it is going to be done in the operation theater. It is going to be just like any other surgery. And whenever the body is handed over to the relatives, the body is in a very perfect condition. So don't worry about that. So that is again a misconception. And apart from that, there are all other small misconceptions that these doctors are patient is not brain dead and they are taking away the organs. So that is again a big misconception. But for here, we have very streamlined processes. Government has done it. And obviously, always the government certifies that the patient is brain dead. It is not the doctor or the hospital which certifies the brain dead. So that government has been taking care of. So these are the few misconceptions in the society.
Okay. I mean, they're difficult to deal with, I must say. Not an easy way to breach the mindset. I can understand.
And that is where I think so the social counselors and the grief counselors in the societies are very important. Every city, major city should have a group of grief counselors who really can go through the hospitals and help them to have more and more organ donations.
Right. And sir, how would the medical teams now monitor the long-term success of a heart transplant, let's say after the first year? And what follow-up care is usually required to maintain that quality of life eventually?
So there are set protocols available, and normally all these patients, they get a booklet wherein with the fixed dates, everything is mentioned that on this date, you have to come for follow-up. On this date, your angiography will be done. On this date, your routine whole body checkup will be done. Some blood investigations. So there is, I would say, a good calendar given to all the patients. If they really stick to that calendar whole life, then I think so that should not be an issue. And second very important thing is we tell them that if there is any small issue, you can definitely consult your local physician. But yes, ask them to talk to us, because there are certain specific things which not all general physicians may be knowing about the transplantation, post-transplantation care and everything. So any new medication, any new investigation or anything new, they have to keep us in the loop. The transplant team has to be there in the loop for any other things. So I think so this 3, 4, 5 things, if you take care, and obviously after 5-10 years of your transplantation, because of the side effects of the immunosuppressive drugs, there are certain side effects like hypertension, dyslipidemia, that is the cholesterol going haywire, diabetes creeping in. Initially, patient may not be diabetic, and in very few cases, 15% cases, they may develop cancers, that is the skin cancer, melanoma, or lymphoma. So these are the few cancers. So we are aware of that. So accordingly, we do investigations at regular interval for screening all this probability, so we can find it out early, treat it early, and the patients are fine.
Okay. And now something very important that we've been working on is health literacy, particularly sensitizing the Indian population. So in context with heart transplantation, sir, how important for you is health literacy for patients who are undergoing, heart transplants? And what educational resources would you say should be provided to such patients?
Or particularly heart transplantation or in general?
Both. Let's say both.
So both is very difficult because it's a very, very, very huge area. But yeah, I think so. What is very important is health literacy is unfortunately the knowledge spread that has been done by the hospitals and by the doctors is very limited at this point of time. Particularly if the patient is of heart failure, we know that probably after 5 years, 10 years, this patient may require heart transplantation. But unfortunately, till the time patient is almost crashing, doctors are not making them aware that these are the other form of modalities available for your treatment. So I think so the best way of this is the one that you are doing is the podcasts is a good modality of spreading the knowledge across the society. Good media coverage of all these things, all detailed analysis and detailed things of transplantation or health or cardiac care or diabetic care. So if that is done at a very regular interval to all the patients is very important. And third very important thing is, I think so it is the responsibility, social responsibility of the hospitals, all corporate hospitals, to educate their patient, whoever is coming with whatever problems, they need to give them some literature and some understanding of the disease so that they really take care of themselves.
Right. That's wonderful, actually. So just summarizing this very, very interesting session, sir, what key recommendations would a heart transplant specialist as yourself would include in a to-do list for your patients to help them live a healthier and a more fulfilling life after undergoing the procedure?
As I previously mentioned, it is just maintain your important thing is the discipline life, maintain your hygiene levels, maintain your psychological boosting up. Means you should be a very positive mindset person. And that is very, very important because these patients, they may get some hiccups in their lifetime, something here and there. So keeping that positive mindset. So I always keep them boosted. You are doing fine. You are getting fantastic. So giving them positivity is very important. So we tell them, and obviously healthy lifestyle, avoiding all the smoking and alcohol and junk food and everything, which is important for all other patients, is important for the transplant patients also. So I think so these are the few things: disciplined life, healthy lifestyle, giving positivity to the patient, making them psychologically strong, and remaining happy.
Right. So adhering to your doctor's instructions for me, and then a positive and a very, let's say, a good, healthy lifestyle and a positive mindset are all the key to a very healthy life, even after a donation or a heart transplant surgery. So, on wonderful notes, sir, I really appreciate your presence with us today. And I'm hoping
Thank you.
that the enlightening information shared will be valuable to many families out there. So thank you so much for joining us. It's really been a pleasure.
Thank you. I think so. Probably this may help to spread that message of the heart transplantation and organ donation, and more patients will benefit by getting a heart transplantation and with more organ donation there. So thank you very much, and it was pleasure interacting with you.
Thank you so much, sir. And for more such informative videos, please do subscribe to our channel and press the bell icon for regular updates. Thank you once again, sir. Thank you.
Thank you.